Hello all. My name is Sarah Smith and I'm a student at Bellevue University. For my Ethical, Legal, and Professional Issues class, I am discussing whether or not it is possible to remain neutral regarding my future clients' values. While I strive to remain neutral to create a safe space for my client, achieving complete neutrality might be challenging as everyone has their own perspectives. Before beginning counseling with any client, I believe it is essential to administer an initial assessment to understand my client's fundamental values and beliefs that guide their behavior and decision making. With that said, conflicts of values can arise in various counseling situations, such as differing beliefs about family dynamics, lifestyle choices, or even spiritual religious beliefs. It's essential for counselors to navigate these situations with empathy and understanding while maintaining a professional boundary. Several scenarios come to mind where a conflict of values could occur in my line of work as a professional counselor. For instance, I may have a client whose religious beliefs strongly influence their lifestyle and choices. For example, a client who has a gay son does not approve of or support their child due to their religious beliefs. If I do not share my client's beliefs and values, it might be challenging to provide support without bias. When faced with clients' religious values differ from mine, focusing on active listening and empathy is essential. Understanding my client's perspective without judgment and creating a safe space for open discussion is crucial. Using these counseling skills can help build trust and rapport. It is also important to educate myself on my client's religious beliefs. I will ask my clients questions and to research outside of work to better understand them and help them effectively and competently. According to Corey 2024, it is essential to seek consultation if your countertransference might undermine the therapeutic endeavor or harm the client. Page 107. Recognizing my personal feelings during sessions will help tremendously, as well as being able to reflect on the sessions with my clients. Several issues can arise if I do not work on my countertransference before, during, and after my sessions with my clients, and it is in my client's best interest that I address these issues when they arise. Even ethical codes emphasize the importance of recognizing, managing, and utilizing these emotions appropriately in the therapeutic relationship. Another area where I could potentially see conflicting values is working with a culturally different client with differing values. According to the 2014 ACA Code of Ethics, the introduction to Section A notes that counselors are to actively attempt to understand the diverse cultural background of the clients they serve. Page 4. In addition, basic competence requires that counselors gain knowledge and skills pertaining to be a culturally competent counselor. Corey, 2024, page 81. While working with those who are different than me, it is important to acknowledge cultural differences and potential value conflicts without imposing my personal beliefs. I need to recognize and respect the cultural differences and values of my clients while maintaining professional boundaries and not allowing my personal values to influence the therapeutic process. I can, however, see possible influences that might become problematic. For instance, there are cultural and social norms that encourage violence. My values and beliefs do not align with these cultural and social norms. In the state of Nebraska, mental health practitioners have a duty to warn of patients threatening violent behavior. The state statute explains that there will be no monetary liability on the part of, and no cause of action shall arise against any person who is licensed or certified pursuant to the Mental Health Practice Act or holds a privilege to practice in Nebraska as a professional counselor under the Licensed Professional Counselors Interstate Compact for failing to warn of and protect from a patient's threatened violent behavior or failing to predict and warn of and protect from a patient's violent behavior, except when the patient has communicated to the mental health practitioner a serious threat of physical violence against himself, herself, or a reasonably identifiable victim or victims. Page 1. This state law gives me a sense of security and protection if such circumstances occur. When a client talks about violence, I must assess the situation, even if they are adhering to cultural and social norms. To remain neutral regarding my client's values, I must educate myself on types of violence, the severity of the threat, the intent, and the context. If there is an imminent threat or harm, it is crucial to take immediate action. It would also benefit me to educate myself on culture and what scenarios might arise during counseling to prepare myself better and avoid harming my client. The 2014 ACA Code of Ethics in Section A4A states, "Counselors act to avoid harming their clients, trainees, and research participants and to minimize or to remedy unavoidable or unanticipated harm." Page 4. As much as I have worked toward being the best version of myself in working on my childhood trauma, I know there will be circumstances that come up in counseling that might trigger an emotion for me. Exploring my clients' family dynamics is crucial to understanding the patterns of interactions, relationships, and behaviors that occur within their family. In cases where the client refuses to improve their communication skills, I feel it would be challenging not to impose my values and beliefs about family dynamics onto my client. Living in a dysfunctional home myself, communication was not present. However, over the years, I have learned that the first step to improving communication patterns is to become aware of the issues. If a client were to talk to me with disrespect and anger, it would be challenging not to refer them. I think it is essential to work on recognizing and acknowledging existing communication issues within my client's family to improve overall relationship satisfaction. I think it is also important to encourage my client to practice active listening skills. This means fully concentrating on what is being said and giving one's full attention. If there are communication issues within my client's family, I would also encourage them to set aside specific time for the family members to communicate openly. This allows each family member a chance to feel heard and discuss any essential topics in a structured environment. Lastly, I will encourage my clients to use I statements, allowing them to express their feelings and thoughts without making others defensive or feel blamed. Overall, I believe it is possible to remain neutral regarding my client's values. It is important to follow all state statutes and ethical guidelines, along with continuing education in consultation with a supervisor or colleague when needed. After my research and personal experiences with counseling, I believe it is imperative to give new clients an initial assessment to understand their fundamental values. This will help me gather information about my client's history, the main issue they are experiencing, goals and expectations, and cultural background, identifying their support system, and more. As a beginning counselor, I need to be mindful that conflict of values can arise in various counseling situations. Being prepared for many types of situations will allow me to become a more ethical and competent counselor.